Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the Phia Group.
Hello, everybody. Welcome to the Phia Group's Empowering Plans Podcast. Today, your intrepid hosts will be me, Nick Bonds. I'm one of the consulting attorneys here at the Phia Group. I work over on the PGC side of things. And then with me today as my co-host is Corey Crigger. Say hi, Corey.
Hi, Corey.
Good work. Corey, you're one of our attorneys on provider relations, right?
Yeah, absolutely. So senior attorney, provider relations department, dealing a lot with balance billing, RBP questions, and kind of a catch-all.
All right. I'm fully remote these days. I work based out of Houston, Texas now, and you're based out of our Kentucky office.
That's right. Just inside of Louisville, Kentucky. It's a nice 74 degrees. Beautiful day here.
You got us beat in Houston today. It was a heck of a thunderstorm earlier. The lights flickered a little bit. I was a little nervous, but it at least wasn't hot for a change, so I guess I'll take it. So Corey and I, peek behind the curtain here. We schedule these podcasts a few months out, but we don't necessarily always have a topic lined up. So I had actually been kind of casting about for a topic to hit for today's recording with my buddy Corey, and was sort of struggling a little bit. But then a couple weeks ago, I actually had the privilege of attending the Free Market Medical Association conference up in Fort Worth. This FMMA conference is all about trying to break away from sort of the traditional healthcare models, trying to break away from traditional hospital systems, traditional fully insured plans, which, here at the Phia Group, we are very much copacetic with all of that, trying to really take advantage of what self-funding has to offer. And one of the things that they spoke a lot on at this year's FMMA was a concept called direct primary care. And that also lines up pretty well with some of the Phia Group's ideals. So direct primary care, or DPC, as the cool kids call it, it's an option that's pretty popular, or it's at least growing in popularity for a lot of group health plans, specifically because it is so different from that traditional model of a large hospital system or a traditional insurance plan. Essentially, a group has a direct arrangement with a primary care physician, sort of like having a doctor on retainer who can address any issues that participants under the health plan might have. It does leave a lot of flexibility for the participants. It leaves a lot of flexibility for the health plan, and it's usually a little bit more of a stress-free arrangement for all parties involved. So Corey, over in the provider relations world, dealing with a lot of balance bills and stuff, I don't imagine you get a lot of issues coming in the DPC base, do you?
Oh, no, not at all. And specifically because of what you mentioned, right? It's almost a membership basis. Patients aren't getting billed. It's a contractual relationship, generally speaking, between the employer and the physician. So it really makes for a pleasant experience with the patient and not too much heartburn.
Yeah, exactly. It's a very frictionless process when it's set up well. Some of the perks you can probably imagine, it steers employees basically to a much lower cost option than a traditional hospital plan or even a traditional network option. It tends to do a better job of driving utilization, which can counterintuitively actually lower claims and lower costs for the plan because members are a little more proactive in their healthcare, taking advantage of the DPC arrangements. They'll catch minor things before they can become big things. It's sort of a win-win that way for the plan. So you might see a few more claims coming in through the DPC, but they're usually a little bit more manageable and ultimately can save the plan and the employees a lot of money that way.
And not just that, Nick, but there's also the relationships, and I know we're going to talk a little bit about my experience with the Louisville DPC in a moment, but Dr. Manier, the Louisville DPC, also has his relationships with radiology and lab techs, right? So things that would normally cost more, that if those services were rendered through your network, can cost less overall for the employer because of the relationship that the DPC has with those ancillary services provided. So it's a big win-win.
Yeah, that's a great point, Corey. And I think that does really speak to just the overall flexibility. Now, one of the things that you have to keep in mind is there's a little bit of legwork involved in setting up a DPC arrangement. I know for the Phia Group, Phia's HQ is based out of the Boston area in Massachusetts, and setting up DPC arrangements for some of our satellite offices, like in Kentucky, took a little bit of work. But once you have a system in place with a provider who knows what they're doing and they have arrangements with labs and with testing services, you can really get a lot of value for the employees and the plan that way. And I think that something else to consider is how to integrate DPC with the employee plan. We see some groups try to integrate the DPC arrangement with the health plan itself, but that can get complicated quickly, which I guess we can go into that in a little more here in a minute. But I think one of the big things to remember is that for a long time, DPC expenses weren't really considered reimbursable medical expenses for a health plan, especially like an account-based plan, like an HRA or an HSA, which meant that it was difficult to cover those expenses through a health plan. That's changing a little bit now. So the IRS has some proposed regulations that have sort of been pending for a while. I think the last they were updated was midway 2020, but those are sort of working to redefine DPC arrangements under the tax code and make them more easily reimbursable under a group health plan. But keep in mind, those are just proposed regulations. They're not finalized. Also, some big things to remember is that the health plans may be limited in what they can actually reimburse depending on the plan setup. Like we can kind of dive into in a bit, an HSA is not entirely compatible in a lot of ways with the DPC. And for that reason, we generally recommend that the employers pay for DPC outside of the plan. And that sort of just augments the flexibility that they have available. I know that the Phia DPC is set up that way. It's not fully directly integrated with our group health plan, but it still offers a lot of flexibility. And I know, Corey, you've had some experience utilizing the Phia DPC. Can you talk a little bit about what that was like for you?
Yeah, absolutely. I always think it's great to tie some personal anecdotes into things like this, right? Because we talk about these concepts of DPCs and ways to contain costs, but it always helps if you have a little bit of color commentary to go along with it. And that's kind of what I'm here for. So just to kind of touch base on Phia's DPC arrangement in the Louisville office. So we actually have two DPC providers that we could utilize. One of them is a male, that's who I use in the area. And then there's another female practice that has, I believe it's 3 female physicians. That's who my wife actually utilizes because of location, convenience, comfort, personal preference. So we appreciate the fact that we have options within our options even. But this is the part of the podcast that's going to be, I know too much about Corey's health, but I think it's really going to be beneficial and it's going to be great. I think there's 3 key points to the DPC that makes me really excited to utilize Dr. Manier over a traditional primary care physician. And those 3 points are he's personal, it's convenient, and he's thorough. For the personal standpoint, the first appointment that I set up with him was, I think, like 18 months ago, right when we got the DPC program off the ground in the Louisville office. And he let me know, he's like, this first appointment is going to be like 2 to 2.5 hours because I want to get to know you. I don't want to just look at your records. I don't want to, just judge you based on numbers on a screen. I need to get to know you because you are my patient. So we did the full medical workup, both sides of my family. But before we even did any of that, it was more of just chit chat of getting to know me, getting to know my hobbies, my activities, some preventative care so I can enjoy my hobbies. It's a tailored experience to the health care that I need, not how do I see as many patients as possible to maximize or hit my quota. And that's one thing that I really, really appreciate. And the other thing that makes it personal to me is that Dr. Manier here in Louisville shares the vision of the Phia group, right? We want to contain costs. Dr. Manier always points out to me, he was like, hey, listen, if we build these labs that you had for your yearly to your health plan, it would have cost your health plan $250, but our relationship, it's only going to be $58, and it's not going to cost you anything because it's covered on the contractual relationship we have with Phia. So seeing a physician that understands the healthcare system needs work, utilizing him and making sure that he knows that I'm not just a patient, I'm a person that has a tailored healthcare plan, all those things keep me going back. It's convenient. My family and I were diagnosed with COVID. We tested positive back in February. No massive issues. We had it much better than most. I know that that's not a story that is shared among everyone, but we had very mild symptoms. And I was just able to text Dr. Manier and say, hey, we have 3 positive COVID tests in my household. What can we do? Within 5 minutes, I was on FaceTime with him, gave me a vitamin regimen, gave me some pointers on things to avoid. I was the only one in my family that lost my taste and smell. gave me some aromatherapy techniques that had worked, gave me some insights on eating certain types of food to get my taste buds kicked back in. And it was just a very convenient experience, right? I didn't have to leave my house. I didn't have to mask up. I didn't have to worry about infecting others. It was a phone call at my convenience, and it was great. Nick can attest to the fact that my work calendar gets extremely hectic. We are covered up a lot of times during the day. I've never had a problem getting in with Dr. Munir. He can work around my calendar. And the best part is because it's a tailored experience and it's not just open to the general public, so to speak, is there's no waiting room, right? When it's time for my appointment, I walk in and the appointment starts immediately. It's straight to the scale, hot weight, straight to the room. What brings you in today? There's no 30, 40-minute waiting, me trying to check emails while I'm in a waiting room or hop on a meeting remotely. It's straight to the point, and I definitely appreciate that.
That alone sounds fantastic. Just not having to sit in the waiting room.
Absolutely. You get out of the waiting room purgatory and you get right down to business, right? That's the way that I like to do things. I don't like to wait around too much. I like to get right to it. So yeah, it's amazingly convenient. And the last thing is that it's very thorough. So for the last few years, I've been battling with high cholesterol, and we have went through a lot of different steps with lab work, a lot of corrective actions on my part through diet and exercise. And this last appointment, I actually just saw Dr. Munir 2 weeks ago. That was kind of our watershed moment. Like, okay, if your cholesterol is not in check by this day, we need to talk about the medication route, right? So we did the labs. I went to the appointment and we went through my lab work. And he was very thorough. He said, listen, I can tell that you have done all the things that we've talked about. I can tell you're exercising more because your LDL number is up. I can tell you're eating better because your HDL number is down. Your cholesterol ratio is now where it needs to be. Your problem is that your total cholesterol is still a little high. So we made the decision together that we were going to do a trial run on a very low dose of medication, that we were going to do labs 6 weeks and then another 6 weeks out. And hopefully, with the corrective action I've taken with my own lifestyle, with diet and exercise, coupled with the medication, that number is going to get low, and then it'll be a transition out of medication, and it'll just be maintaining the low cholesterol, right? So it was a very thorough exam. He went through it. We have an action plan. I didn't just get a script handed to me, say, hey, take this, it's for your cholesterol. We talked about alternative methods. We talked about how important diet exercise is. But we came to a decision tree and making the decision that we're going to do this trial run through the summer with medication. And then the other thing that I really appreciate is I was injured my last year of law school. I was rear-ended by an 18-wheeler and still have some back issues to this day. But, you know, the flexibility of the DPC is he's not a chiropractor, and I would butcher the name of it if I tried to say what it is, but it's very akin to some chiropractic procedures. He does some bending, some folding, gets me aligned. And I can do that 3 to 4 times a month with no charge to myself. I just have to text. He gets me in. I'm in and out in 20 minutes, and I feel great for the rest of the month. So the personal, convenient, thorough experience is what I would say the Phia DPC experience is.
Yeah, wow. That sounds like it served you very well. I think a lot of what I'm hearing there is that, you know, part of what facilitates that flexibility and facilitates that personal touch and the thoroughness that the DPC provider is able to achieve is really going back to one of the first things you said there, that he shares the goal that the Phia group has of trying to contain costs and provide the best care possible. And I think that that's what really sets apart a DPC relationship, is that it's a relationship. It's not just, you know, a network contract or a health insurance policy. It's an ongoing relationship where the goals of your provider and the patients and their employer are all much better aligned than in a typical relationship. And I think that, you know, your experience is a testament to that. Well, we've talked a lot about how great a DPC arrangement can be. I think we've cited at least a few people about it, I hope. But I know that on the consulting side, we do get some routine questions about DPC and how it works, how it can be set up. We can rattle through a couple of these here. So I'll fire off some questions at you, Corey. I sort of hinted at this before, but HSA eligibility and direct primary care are not always super compatible. Off the top of your head, can you tell me why?
I would believe that one of the answers is that we're largely preventative, right?
Right. The preventive parts of the DPC those would actually be less problematic under an HSA. I think what a lot of plans run into, though, is if they're offering an HSA qualified HDHP, they can't have what is known as disqualifying other coverage. And so the DPC, if it offers anything beyond that preventive care, would basically become disqualifying other coverage, and then an employee that had both would no longer be able to contribute to their HSA. So if a plan is trying to offer an HSA alongside their DPC under the health plan, it really runs into a lot of potholes, basically. Which is another one of the reasons we most frequently see these arrangements at least paid for by the employer outside of the plan. A few other issues that we'll see coming up pretty frequently, people will ask, can you pay for these with plan assets under a supplemental ERISA plan? I just told you, you can, depending on how your plan is structured, though, it may not work as well. And then you can absolutely pay for these outside of the plan with employer assets. Corey, that kind of goes to some of what you were talking about, that if you're paying for DPC within the scope of a plan, you have a few more limits on how things can be reimbursed, how things have to be processed, but the employer paying for that directly, they have a lot fewer shackles on how they can work with the DPC provider. And then you can probably guess where this one's going, Corey, but how do you feel network agreements feel about DPC arrangements?
I think it's my favorite answer in the law, and the answer to that is going to be, well, it depends on how your network's structured.
That's very, very true. Yeah, a lot of networks, the super persnickety ones, they require not only that they get most favorable pricing, but that they get it by a certain margin. And you'll have to make sure that your network arrangement and your DPC arrangement, if you have both, we've seen some plans fully commit to just the DPC, or some plans might be fully reference-based pricing and offer a DPC alongside it. But one of the other big issues the plans have to worry about is making sure that their DPC arrangement and their network arrangements are copacetic. So that's a few of the big highlights. I know we've thrown a lot out there for y'all today. If we've piqued anyone's interest, you can always reach out to the Phia group. PGC side's happy to field any questions you've got. Corey, did you have anything else you wanted to add to wrap it up?
No, it's a pleasure joining the podcast. I hope it came across how excited I am about this topic. I could talk about a lot of topics, but this one was one that really hit close to me. I've been a cheerleader of the Louisville DPC, and hopefully that this touches someone else out there in podcast land, and they can provide a benefit to some of their employees, and they can have a pleasant experience the way I had.
Yeah, I wholly support that. I want to thank you, Corey, for being so candid with your personal experience. It sounds like it's really, really touched your life in a very positive way, and hopefully it can work for some of the groups we work with, at least as well as it's worked for you. So again, thank you, Corey, for joining us today. Thank you, everybody, for listening. My name is Nick Bonds, and this has been the Empowering Plans Podcast. See you again soon, everybody. Have a great day.